Privilege to introduce our keynote speaker, Lee Shapiro. He is the president of Allscripts. Lee oversees the company's strategies, corporate marketing, government relations, mergers and acquisitions, internal operations, basically entirely. He also serves as the executive sponsor for Allscripts in various key strategic relationships. Time for the society and give it back to the society whatever best we can. As you can see, the way he's structured, he's a great runner. He's a marathon champion. Probably he ran before he could walk. Well, I'm truly privileged, and honestly, it's an invigorating experience to invite Lee to this conference, and may I welcome Lee to deliver the address. Lee, the stage is yours.
Mere liye suman hehi, lekin apke swagat or katir dari se, me or bi samanit mesus kortahu. So I'm hoping what I said is, thank you for the opportunity to be here with you today. I'm so honored to be invited by Sangeeta, and even more honored by the warmth and courtesies extended to me since I've arrived. A special thank you again to Apollo for putting on this conference. Certainly some great work by Sangeeta in terms of helping for the past 3 years bring an important organization together. Also, since I'm standing between you and lunch, I will try to make my remarks brief this morning. Very quickly, just to introduce you to Allscripts, we are a publicly traded company in the U.S. with over $1 billion in revenue and 7,000 global employees. That includes close to 2,000 here in India, spread across 3 campuses. Our goal is to build a connected community of health, one in which providers across entire communities have the information they need when they need it to deliver coordinated, effective patient care regardless of what technology they use. And our footprint is expanding globally. We have clients in Canada, the United Kingdom, Australia, Singapore, and Malaysia. And as we continue to grow internationally, Allscripts, like you, is confronted by common problems that know no boundaries. As our population increases, so too will the number of elderly, who in the United States account for 80% of all healthcare costs. Even as the need for healthcare is rising, fewer people are choosing medicine as a career. The shortage is worse in developing nations. In case you're wondering, Norway is the best with 42 physicians for every 1,000 people. Many places in Africa have less than 1 physician per 1,000. Rising global wealth is spreading, and with it, the diseases of prosperity, fueled by obesity and inactivity, diabetes, heart disease, and hypertension. By 2030, it is expected that chronic diseases will outpace infectious diseases as the leading cause of mortality. And as we heard earlier, the rising cost of care. We're well aware of the cost curve, which has outstripped GDP in all OECD nations for nearly 50 years. To put the projection of rising costs from IHS Global Insight in context, the McKinsey Global Institute projects that global GDP during roughly the same period will double from 60 trillion to about 120 trillion US dollars. So if nothing else changes, we're looking at world healthcare costs growing from about 0.5% to nearly 12% of global economic output. That's an enormous burden for states who are facing many other priorities, a burden we may be unable to carry. challenges are compounded by the age-old problem tracks GDP. Poor in rural areas, we heard commentary earlier, especially in rural areas here in India. But leveraging advances in technology. When you think about healthcare, rather than building a network of new hospitals, emerging markets can move quickly to address the needs of their citizens with straits this ability. In India, decades of state-owned monopolies left the vast only the province of the rich. Today, nearly everyone has one, even in rural areas. The example of India's cell phone usage shows how an innovative technology can leapfrog major gaps in infrastructure in the developing world. That's a fact that I believe bodes very well for our ability to solve some of the global challenges I mentioned earlier. For the very reason that its healthcare infrastructure is less developed, the developing world is perfectly positioned to take advantage of new breakthroughs in healthcare information technology. So let's take a look at some of the healthcare technologies that I believe have the ability to enable better health. Some already established in developed nations and just now taking root in developing nations, and some that are new to all areas of the world. Works with pharma companies and telecom providers to help people across Africa, the Philippines, and India identify the authenticity of medicine using free text messaging services. In the past, when there was a disease outbreak, epidemiologists would swoop in, armed with diagnostic kits, and spend weeks interviewing victims and gathering data, mostly in secret. New technology is democratizing the disease hunting process while helping patients protect themselves from outbreaks. Kazemil does this by monitoring Twitter for mentions of any 6 cold and flu symptoms. The software then presents the tweets in a form of interactive map. It was developed for a software company, a pharmaceutical company, SSP in Japan. You're looking at a data visualization of Tokyo, where each of the colored diamonds is a tweet of cold or flu symptoms. Healthmap.org is another example of monitoring social media to deliver real-time intelligence on a broad range of emerging infectious diseases for a diverse audience, including local health departments, governments, clinicians, and international travelers. These innovations hold great promise for empowering patients to avoid infectious disease while also accelerating the ability of governments and international bodies to respond to outbreaks. Of course, not all of healthcare's problems can be resolved by empowering patients. Trend 4, or what I call information clarity, addresses a systemic problem within complex health systems and communities, especially those more affluent. With affluence comes more care. With more care comes more information. But the problem is that that information is not available in one place or ways that's commonly understood. To coordinate care for patients who see multiple providers, often in entirely different organizations, we need to move information between distinct IT systems from different vendors in different locations, and then translate data so it's understandable by providers. That is a huge challenge. A good example of where we have a start is at Orlando Health, one of Florida's most comprehensive health systems. Orlando Health has 2,000 beds spread over 6 hospitals, 350 employed physicians, and thousands of independent physicians who refer patients to their hospitals. Using the Allscripts community record, Orlando Health can securely exchange information between clinical systems from multiple vendors. The solution aggregates and normalizes the data and presents it in the appropriate place and time within the caregiver's workflow. Today, Orlando's clinicians can receive radiology orders, lab results, demographics, and other information from these disparate systems and view all the information in one place within their Allscripts electronic health record. We call that a single view of the patient.